Good evening, one and all. We welcome you all to the international webinar series on holistic health, well-being, and sustainable development 2022-2023, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 76 years of independence, United Nations Sustainable Development Goals 2015 to 2030, World Health Organization 75th anniversary year, and also India's G20 presidency in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Art, Sciences and Wellbeing. Before we start our sessions, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
With the blessings of Almighty, we shall continue with today's sessions. Today, we are commemorating International Day of Epidemic Preparedness, which is celebrated and commemorated on 27 December every year. COVID-19 is a human tragedy, but it has also created a generational opportunity, an opportunity to build back a more equal and sustainable world. The response to the pandemic and to the widespread discontent that preceded it must be based on a new social contract and a new global deal that create equal opportunities for all and respect the rights and freedoms of all, as quoted by Antonio Guterres, Secretary General of United Nations, from Nelson Mandela's lecture, Tracking the Inequality Pandemic, a New Social Contract for a New Era. As exemplified by the ongoing coronavirus disease, COVID-19 pandemic, major infectious diseases and epidemics have devastating impacts on human lives, wreaking havoc on long-term social and economic development. Global health crises threaten to overwhelm already overstretched health systems, disrupt global supply chains, and cause disproportionate devastation of the livelihoods of people, including women and children, and the economies of the poorest and the most vulnerable countries. There is an urgent need to have resilient and robust health systems reaching those who are vulnerable or in vulnerable situations. International Day of Epidemic Preparedness on 27 December every year reiterates the need to manage, prevent, these epidemics in the event of in the event of absence of international attention. Future epidemics could surpass previous outbreaks in terms of intensity and gravity. There is a great need of raising awareness, the exchange of information, scientific knowledge, and best practices, quality education and advocacy programs on epidemics at the local, national, regional, and global levels as effective measures to prevent, respond to epidemics. It is the most important to strengthen epidemic prevention by applying lessons learned on epidemic management and how to prevent the stoppage of basic services and to raise the level of preparedness in order to have earliest and most adequate response to any epidemic that may arise and recognizing also the value of an integrated One Health approach that fosters integration of human health, animal health, and plant health, as well as environmental and other relevant sectors. International cooperation and multilateralism play an important role in the response to epidemics. We need to stress the significance of partnership and solidarity among every individual. So, international cooperation and multilateralism play an important role in the response to epidemics. We need to stress the significance of partnership and solidarity among every individual, community, and state and regional and international organization in all stages of epidemic management, as well as the importance of considering a gender perspective in this regard. The United Nations, in particular, the World Health Organization, plays a pivotal role in coordinating response to the epidemics in accordance with its mandate and in supporting national, regional, international efforts to prevent, mitigate, and address the impacts of the infectious diseases and epidemics in accordance with the goal of advancing the 2030 agenda. So we need to recognize the primary role and responsibility of the governments and the indispensable contribution of relevant stakeholders in tackling global health challenges, especially women, who make up the majority of the world's health workers. UN member states commit to ensure inclusive, equal, and non discriminatory participation with special attention to those who are vulnerable or in vulnerable situations with the highest chance of epidemic infection. The UN General Assembly invites all member states, organizations of the United Nations system, and other global, regional, and sub regional organizations, the private sector, and the civil society, including the government organizations, academic institutions, individuals, and other relevant stakeholders, to observe the International Day of Epidemic Preparedness annually in an appropriate manner and in accordance with the national context and priorities through education and awareness raising activities in order to highlight the importance of prevention of preparedness for the partnership against epidemics. So the COVID-19 pandemic is more than a health crisis. It's an economic crisis, a humanitarian crisis, a security crisis, and a human rights crisis. The crisis has highlighted several fragilities and inequalities within and among nations. Coming out of the crisis will require a whole of society, whole of government, and whole of world approach driven by compassion and solidarity. The UN Secretary General has launched the UN Comprehensive Response to COVID 19 to save lives, protect societies, recover better. The World Health Organization has an essential role to play in supporting member states to prepare for and respond to and recover from emergencies with public health consequences and the pandemic and epidemic diseases on WHO's radar and its work on managing epidemics. WHO chief declares end to COVID-19 as a global health emergency with great hope to end to COVID-19 as a public health emergency, stressing that it does not mean disease is no longer a global threat. For over 12 months, the pandemic have been on a downtrend, he said, with immunity increasing due to highly effective vaccines developed in record time to fight the disease and infections. Death rates have decreased and the pressure on the overwhelmed health systems has eased. This trend has allowed most countries to return to life as we know it before COVID-19, Tedros added. The World Health Organization, WHO, is working closely with global experts, governments, and partners to rapidly expand scientific knowledge on this new virus to track the spread and virulence of the virus and provide advice to countries and individuals on measures to protect health and prevent the spread of the outbreak. Coronavirus, COV, in short, are a large family of viruses that cause illness ranging from common cold to more severe disease. Coronavirus, COVID-19 disease, or in short known as COVID-19, is an infectious disease caused by SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular diseases, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. Anyone can get sick with COVID 19 and become seriously ill or die at any age. The best way to prevent and slow down transmission is to be well informed about the disease and how the virus spreads and protect yourself from others from the infection by staying at least 1 meter apart from the others, wearing a properly fitted mask, and washing your hands or using an alcohol based rub. Get vaccinated when it's your turn and follow local guidance. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, or breathe. These particles range from larger respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette, for example, by coughing into a flexed elbow, and to stay home and self isolate until you recover if you feel unwell. So, to prevent infection and slow transmission of COVID 19, get vaccinated when vaccine is available to you. Stay at least 1 meter apart from others, even if they don't appear to be sick. Wear a properly fitted mask when physical distancing is not possible or when in poorly ventilated settings. Choose open, well ventilated spaces over closed spaces. Open a window if indoors. Wash your hands regularly with soap and water or clean them with alcohol based hand rub. Cover your mouth and nose when coughing or sneezing. If you feel unwell, stay home and self isolate until you recover. COVID 19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms include fever, cough, tiredness, loss or taste or smell. Less common symptoms are sore throat, headache, aches and pains, diarrhea, a rash or skin or discoloration of fingers or toes, red or irritated eyes. Serious symptoms include difficulty breathing or shortness of breath, loss of speech or mobility or confusion, chest pain. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days.
There are at least 4 to 5 million lives that are saved as a result of being vaccinated, year in and year out. Immunization is one of the most effective, most impactful health interventions in all of human history, and I'd love to tell you why that is and about it. Tens of millions of people, in fact, over the course of human history, hundreds of millions of people died from smallpox. It was a dreaded disease. And in the late 1700s was an amazing breakthrough. A British physician, Jenner, noticed that milkmaids who had been infected not from smallpox, but from a related virus called cowpox. They were pretty immune from getting smallpox. And so he used that observation to, in fact, immunize an 8-year-old boy, James Phipps, using the cowpox virus. And then weeks later, he exposed James Phipps, with, of course, the permission of his parents, to smallpox, and he didn't get sick from smallpox. And smallpox is a disease we don't have anymore anywhere in the world. And the reason we don't have this disease is because of vaccination. Another disease that's really front and center, big spotlight on trying to eradicate this disease, meaning wipe it off the face of the earth once and for all, just as we've done for smallpox, is polio. I think everybody knows what polio looks like. Paralysis of limbs, long life, disability. Many people die of polio as well. And this means vaccinating, for instance, in Pakistan, in India, in many other countries, huge campaigns that have vaccinated tens of millions of children in short periods of time. We're now at the point where polio has been reduced by over 99% compared with the way polio used to be before we had vaccines. We're so close to ending this. We're so close to the last few cases. We're so close to ending the transmission of this virus. I worked in a hospital in the country of Haiti, in the capital city, in Port-au-Prince. The pediatric ward in that hospital was full of children who had measles, who had diarrhea, who had meningitis, children who had tuberculosis, children who were born with tetanus. And about a third of children who were admitted to that pediatric ward died on a daily basis. And so many of the illnesses that children came in with were illnesses that were completely preventable with vaccination. It was a really important period for me in my training, in my life, to decide to really devote my career to making sure that vaccines were not only developed for diseases for which we didn't have them yet, but also, perhaps more importantly, that the vaccines that we already have are completely accessible, completely available, completely safe and effective for people in every part of the world, no matter what community you're born in. So we've all been living through what has been an enormously difficult couple of years, this pandemic, COVID-19. And one of the things that the world over, I think everybody knows, is the incredible development in rapid time, in frankly unprecedented time, of vaccines that prevent COVID disease. They work against infection and transmission as well. One of the ways that vaccines have gotten into every country around the world is through the COVAX facility. And the COVAX facility is the mechanism to buy vaccines, which is happening on a billions of dose basis, and get them shipped to countries that need these vaccines that can't buy them on their own. There are 92 countries that are benefiting. And when we think about low-income countries, over 80% of the doses that are provided to low-income countries are coming through the COVAX facility. We vaccinate against diseases that are transmissible from person to person. And that means that each of us presents some risk to someone else unless we're protecting ourselves through the use of vaccines. So I really think about vaccination as a social equity issue and a social justice issue. And there's nothing more overwhelming, there's nothing more tragic than a perfectly healthy child who succumbs to an infection that was completely preventable.
world's 10 largest economies have so far received 70% of COVID vaccines. Low-income countries, mostly in Africa, have received just 0.8%.
Seul un plan de vaccination mondial peut mettre fin à la pandémie mondiale et à une situation injuste et immorale.
To prevent the continual emergence of new and concerning variants like Omicron, we need to fully vaccinate at least 70% of the population in every country. The UN is working to help achieve this by mid-2022. The goal is to protect people everywhere from COVID and allow countries to return to full economic activity. The plan requires at least 11 billion vaccine doses. 8 billion have already been put into people's arms. And because global production is around 1.5 billion vaccines per month, the 11 billion goal is doable, but we have to work together more effectively. Since April 2020, the UN has been co-leading the COVAX facility, a collective effort to deliver vaccines to low and middle-income countries. Alarmingly, vaccine manufacturers have repeatedly delayed the timelines for delivering to COVAX, and yet we have the capacity to overcome this problem. We need to accelerate shipments to underserved countries, boost funding for struggling healthcare. Anything less will leave the door open to new variants of the COVID virus and will put all populations at risk. In short, no one is safe unless everyone is safe.
Around the world, countries needed the same things: medical supplies and equipment, test kits to help determine who is infected, X-ray machines to check people's lungs, personal protective equipment to protect healthcare workers, hand sanitizer and soap so that each person could do their part to slow the spread of the virus. All of these things played a vital role in the fight against COVID-19, and all of these things were in short supply during the pandemic. COVID-19 disrupted supply chains around the world. It tested the resilience of global healthcare systems and exposed weaknesses in public procurement processes. The pandemic had far-reaching consequences. It put immense pressure on production and manufacturing, drove up costs of essential medical supplies, exposed violations of labor rights, and made the problem of medical waste more visible than ever before. But the pandemic also provided us an opportunity to learn valuable lessons and look at the ways in which we can make public procurement processes and supply chains not only more efficient and transparent, but also resilient and sustainable.
I don't think there is one playbook on how a country can respond and be more resilient. I think it's about learning what disruption really meant and then how best to respond.
Marcus McKay is a procurement specialist at UN Ops. His work focuses on developing policy to promote sustainable procurement practices.
Sustainability, in its simplest and most fundamental sense, it covers the environmental elements of something, the economic elements of something, as well as the social elements of something. Procurement in itself and public procurement has a huge In large economies, public procurement can represent as much as 12% of the GDP. So this allows procurement to be a vehicle or a conduit to have significant change and influence. And if you take some of the social elements of sustainable procurement, for example, how through purchasing power can you influence labor standards? How can you influence how you interact with the private sector and drive change? You know, during emergency conditions, sustainability might not always be considered a priority. There's huge demand. There needs to be very quick mobilization. Distribution has to be very efficient. But I think that this is one of the problems that we have when it comes to addressing sustainable procurement practices, is where sustainable procurement or sustainability is segmented as an add-on or a separate element of procurement. These should be fundamental elements which are embedded into how things operate and not a nice to have. They should be part of what's demanded and essential so that we can meet the expectations of the global community as well as our responsibility to the environment and to the global community at large.
Experiencing firsthand the immense challenges that came with acquiring medical supplies during the pandemic was procurement specialist Nines Kosumi.
No one was expecting COVID-19 to hit the marketplace the way that it did. The whole world was trying to purchase from one marketplace, which did not have enough workforce to keep up the production with the marketplace demand, which then led to market prices fluctuating and changing constantly. And when we saw market prices fluctuating, the increase on prices on raw materials did not only affect the healthcare supply chain, it had a wider effect in other marketplace sectors such as infrastructure works, IT equipment. COVID-19 pandemic showed that not all countries are prepared for immediate response in the provision of adequate health services in such challenging environment. In general, I believe that relevant institutions, governments, organizations should reflect on challenges that we have faced in the last 2 years globally and all of the lessons learned during these challenging times in order to improve on our public health procurement process in case we find ourselves in a similar situation in the future. I think in doing this, it would benefit initially the health institutions to be better prepared and provide adequate and efficient healthcare for their population.
Transparent processes and supply chain analysis can help promote fairer and greener supply chains. They can save countries money, which in turn can help ensure countries are better placed to respond in times of emergency.
To build a more resilient and sustainable or stable supply chain, it's important to analyze and understand what the needs are. Fundamentally, supply chain analysis is your ability to assess what's going on in that supply chain. Now, you might do supply chain analysis on capacity, you might do a supply chain analysis on sustainability, you might do supply chain analysis on costing. So a supply chain analysis is how you choose to analyze different components of a supply chain. A very holistic supply chain analysis would obviously take all of those elements into consideration. I think the use of technology plays an important role because of the size, scale, and interconnective nature of supply chains. From a UNOPS perspective, we have thousands and thousands of suppliers globally. So for example, we can use big data as part of our supply chain analysis. And within UNOPS, for example, we analyze our suppliers from a sustainability screening perspective with a significant amount of data. And we use technology for us to be able to harness huge volumes of information in a more digestible or more comprehensive way for us to make a decision.
And by utilizing technology and applying the lessons of this pandemic, we can be better prepared for the next one.
During the first and second waves of the pandemic, focus on work in Delhi's informal settlements. As the world is preparing for the third wave, we knew it was essential to scale our approach to broader audience across India. To do this, we established Verified Sathis, a national network of communicators people trust and recognize who speak directly to their communities. In Hindi, a Sathi is a friend, supporter, or collaborator, and our verified Sathis include celebrities, scientists, micro-influencers, healthcare professionals, and local leaders from informal settlements and tribal communities. Through their work, we have been able to increase COVID-safe behaviors, including vaccination uptake, and help limit the spread and harm of COVID-19, as quoted by Critica. The most persuasive campaigns speak to and represent your audience, work with your audience to communicate in ways they are relevant to them, amplify the voices of influential community members, and create opportunities for people in your community to directly engage with each other. Combining both online and offline activity, the Verified team in India created hyper-local campaigns at a national scale. In our campaigns, we centered real members of our target communities and empowered them to become credible sources of information on limiting the spread and harm of COVID-19. We work closely on our partners on the ground to identify influential people who interacted with their community on a daily basis and connected those local vendors, leaders with renowned doctors and scientists. Because the communities lacked access to healthcare professionals, being connected to well-known doctors was a motivator for Sathis. The direct communication and specialized information helped them feel empowered with timely and accurate information and more confident in their interactions with the community. So far, 800 messengers to participate in Verified Sathis were recruited due to their direct efforts. Hundreds of people in their communities have gotten or agreed to get vaccinated. So you could feel the sense of pride and excitement Sathis experienced through their work in the community. They could see they were participating in something on both a community and at a national level. Many have said that they feel better prepared for future challenges that will arise. Understanding COVID-19 will help us to stay safe. So we were talking about One Health. What is One Health? One Health is an integrated, unifying approach to balance and optimize the health of people, animals, and environment. It is particularly important to prevent, predict, detect, and respond to the global health threats such as COVID-19 pandemic, The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together. This way, new and better ideas are developed that address root causes and create long term sustainable solutions. One Health involves the public health, veterinary, public health, and environmental sectors. The One Health approach is particularly relevant for food and water safety, nutrition, and control of zoonosis, diseases that can spread from between animals and humans, such as flu, rabies, and Rift Valley fever. Pollution management and combating antimicrobial resistance, the emergence of microbes that are resistant to antibiotic therapy. Government officials, researchers, and workers across sectors at the local, national, regional, and global levels should implement joint responses to the health threats. This includes developing shared database and surveillance across different sectors and identifying new solutions that address the root causes and links between risks and impacts. Community engagement is also critical to promote risk, reducing habits and attitudes, and to support early detection and containment of disease threats. World Health Organization formed a One Health initiative to integrate work on human, animal, and environmental health across the organization. World Health Organization is also working with Food and Agriculture Organization of the United Nations, FAO, and the United Nations Environment Program, UNEP, and the World Organization for Animal Health, WOAH, as one of the health quadrupeds. The quadripartite is promoting multisectoral approaches to reduce health threats to the human-animal ecosystem interface. The transformation requires to present and mitigate the impact of current and future health challenges at global, regional, and country levels is outlined in the quadripartite One Health Joint Plan of Action, OHJPA in short. The One Health High-Level Expert Panel, in short known as OHH-LEP, was formed in May 2021 to advise FAO, UNEP, WHO, and WOAH on One Health issues. This includes recommendations for research on emerging disease threats and the development of a long-term global plan of action to avert outbreaks of diseases like H5N1, avian influenza, MERS, Ebola, Zika, and possibly COVID-19. The panel has also a role in investigating the impact of human activity on environment and wildlife habitats and how this drives diseases threats. Critical areas include food production and distribution, urbanization and infrastructure development, international travel and trade, activities that lead to biodiversity loss, climate change, and those that put increased pressure on through natural resource base, all of which can lead to emergence of zoonotic diseases. Zoonosis is any disease or infection that is naturally transmissible from vertebrate animals to humans. There are over 200 known types of zoonosis. Zoonosis comprise a large percentage of new and existing diseases in humans. Some zoonoses, such as rabies, are 100% preventable through vaccination and other methods. A zoonosis is an infectious disease that has jumped from non-human animal to humans. Zoonotic pathogens may be bacterial, viral, or parasitic, or may involve unconventional agents and can spread to humans through direct contact or through food, water, or the environment. They represent a major public health problem around the world due to our close relationship with animals in agriculture, as companions, and in natural environment. Zoonosis can also cause disruptions in the production and trade of animal products for food and other uses. Zoonosis comprises a large percentage of all newly identified infectious diseases, as well as many existing ones. Some diseases, such as HIV, began as zoonosis but later mutate into human only strains. The zoonosis can cause recurring disease outbreaks such as Ebola virus disease and salmonellosis. Still others, such as novel coronavirus that causes COVID-19, have the potential to cause global pandemics. So prevention methods for zoonotic diseases differ for each pathogen. However, several practices are recognized as effective in reducing risk at the community and at personal levels. Safe and appropriate guidelines for animal care in the agricultural sector help to reduce the potential for foodborne zoonotic diseases outbreaks through foods such as meat, eggs, dairy, or even some vegetables. Standards for cleaning drinking water and waste removal, as well as the protection for surface water in natural environment are also important and effective. Education campaigns to promote hand washing after contact with animals and other behavioral adjustments can reduce community spread of zoonotic diseases when they occur. Antimicrobial resistance is a complicating factor in the control of prevention of zoonosis. The use of antibiotics in animals raised for food is widespread and increasing the potential for the drug-resistant strains of zoonotic pathogens capable of spreading quickly in animal and human populations. Zoonotic pathogens can spread to humans through any contact point with domestic agriculture or wild animals. Market selling the meat or byproducts of wild animals are particularly high risk due to large number of new or undocumented pathogens known to exist in some wild animal populations. Agriculture workers in areas with use of antibiotics for farm animals may be increased risk of pathogens resistance to current antimicrobial drugs. People living with adjacent wilderness areas or in semi-urban areas with higher number of wildlife animals are at risk of disease from animals such as rats, foxes, or raccoons. Urbanization and destruction of natural habitats. So zoonotic pathogens can spread to humans through any contact point with domestic agriculture or wild animals. Market sellings, meat or byproducts of wild animals are particularly high risk due to large number of new or undocumented pathogens known to exist in some wild populations. Agriculture workers in areas with high use of antibiotics for farm animals may be at increased risk of pathogens resistance or current antimicrobial drugs. People living adjacent to wilderness areas or in some semi-urban areas with higher number of wild animals are at risk of disease from animals such as rats, foxes, or raccoons. Urbanization and destruction of natural habitats increase the risk of zoonotic diseases by increasing contact between humans and wild animals. As part of One Health approach, the World Health Organization collaborates with the Food and Agriculture Organization and the United Nations, FAO, and the World Organization for Animal Health, OIE, and on the global warming system for major coordinated alert mechanisms of the three agencies to assist in early warning, prevention, and control of animal diseases threats. through data sharing and risk assessment. So anyway, we have to be prepared because of new variants coming up, and it's though it is manageable, but still. So with this, we shall end the commemoration of International Day of Epidemic Preparedness. We have seen how various pandemics are occurring, causing due to interaction with wild animals and consumption of their meat. Often, consumption of meat has always shown adverse effects. So by controlling the consumption of meat and being vegetarian, we could have prevented many pandemics that have been occurred. Today is also commemorated as Visit the Zoo Day in US. It is celebrated on December 27th every year, although the origins of the day are unclear. We know that the idea of zoo stretches as far as back as a couple of millennia. The word zoo is, in fact, the shortest way to refer a zoological park or garden zoo. Zoos are typically home to a range of species and functions as protective shelters for animals within them. An early form of the zoo or zoological garden was called a menagerie. It is said to have been much smaller than the more modern zoo. The first iterations of zoos were private collections and acted as a show of power. Excavators discovered the remnants of a menagerie in Egypt, which they believe dates back to 3500 BC. Famous kings such as Alexander the Great, Greece, King Solomon of Israel, and King Nebuchadnezzar of Babylonia were known animal collectors from their respective times. Evidence of such zoos or collections and animals have been found in the places like China and Rome. The focus of early modern zoos was not on functioning as natural habitats for the species housed in them. Instead, they were more like museums of living animals kept in small display areas. Zoos today work towards educating and entertaining members of the public while also furthering scientific research promoting conservation of species. Today is also commemorated as National Make Cutout Snowflakes Day in US. Just cut out basic shapes or intricate patterns into a beautiful snowflake. And it's a great way to creatively spend or with the family after the hustle and bustle of Christmas and they keep the children out of mischief. Making snowflakes is a modern tradition, but the method of creating is based on an old art of origami. The concept of origami is about folding a piece of paper several times to create objects, and it started in Japan around the 19th century. Another variation is called kirigami, which involves cutting out shapes on the folded paper. Cutout snowflakes include both methods, recurring the folding of paper and then adding cuts in the desired places for a more detailed effect. Just like no two snowflakes are identical, you can cut as many different patterns as you like on your folded paper. So whether it is detailed or basic, Make Cutout Snowflake Day which is a timeless tradition that has a lot of us has grown up with a fantastic way to channel your creativity and remember what it felt like to work with scissors and art supplies as kids. Once you and your family have completed your snowflake projects, you can write your name on them or color them in for a unique personalized touch. Then all you need to do is hang them from the ceiling or onto the window or wherever else you like as a big family of snowflakes. Today is also commemorated as National Fruit Cake Day in December. In US, it's a day for fruitcake lovers who rejoice in the delights of most misunderstood fruit. A fruit cake is a boozy, chewy, rich amalgam of dried fruits, nuts, and sugar, and saturated with your favorite drink that produces a dense, sweet, and textured treat generally served around the holidays. Fruit cakes have been found in ancient Egyptian tombs, so you know that the tradition is steeped in the history as well as the booze. Since the ingredients of fruitcake vary widely, have a party where each guest makes his or her own version of treat, and you can even add a contest for the best version. Winner sends everlasting glory. Fruitcakes are a traditional gift, and a mail order fruitcakes have been around since the early 1900s. So take a note from your ancestors and order a tasty quality fruitcake available through the mail to gift to your friends. You can keep the tradition alive by creating your own fruitcake if you don't have a family recipe. Adapt a recipe from a popular cookbook. All the ingredients can be purchased, but why not make it a family tradition to dry your own fruit? Not only will your fruitcake taste better, but it will be also healthier and better for you. Toast some fresh nuts, use honey instead of sugar, and use top shelf booze to make a real fruit juice, fruit cake, or lover's fruit cake. Fruit cake is consumed in different forms around the world, and we mean all over. It's served in America, the Bahamas, Bulgaria, Canada, France, Germany, Ireland, and many other places. So with this, we shall end today's commemorations. Thank you everyone for joining us. See you all tomorrow at the same time. And we request everyone to quickly fill up the feedback form, which has been raised in the form of polls before leaving the platform.